Hello, friends. A very good morning to all of you out there, and a very, very warm welcome from the entire team of RFA tutors. Your mentor this side. I hope everybody is doing great. Thank you very much for joining in. Hello, walaikum assalam, baby. How are you? Hi, Leila. Hi, Hannah. How's everybody doing? Please write a reminder in the group that we are starting with an introduction, MRCPI Part 2, written March 2026. I'm super proud of you guys that you have started the first read and the discussion and the books together, hands in hands. Thank you very much for joining in. Leila put in the group that we have started the introduction. For all those who have missed the link, please just give a reminder. Hi, Mom. How are you doing today? I'm so proud of you guys and a very warm welcome to all of you. I know you all have been waiting for starting this and lots of apprehensions, lots of queries. What is the starting point? What are those things which you need to know about MRCPI written? Few of you have been through MRCOG too. So I know that the baseline is stronger, but many of you are starting now and it's the first ever written exam for you guys. So whatever the baseline is, we like to have a strong basis to make this exam a success. A very, very doable exam at the very outset, I will reassure you guys. And you all would do great in this exam. Thank you very much. Big hello, Hania. I hope everybody is doing fine. Thank you very much for joining in. I hope you guys have breakfast and you have coffees in your hands. Not a big session, but a chit chat to begin with to make you understand what MRCPI written is, how we start the preparation, what is my way of teaching, and how I want to have you to have a good grip over the subject as well. All right. I know that few of you will be thinking that what are the prospects while we are taking this exam? Few of you will be thinking about that, what MRCPI written holds, and what are those things which we should be knowing about before we start. The questions in your mind in terms of preparation, in terms of starting up the theory, why at first place we are taking this exam, how we have to prepare for MRCPI Part 2 written, and we have heard few of our friends, they can't make it. What is the reason that students, they do fail in this exam, which is considered to be an easy obs and gynae exam? And how we all are going to make it in one go, like your previous batch who had done spectacular results, very, very high scores. And I'm so proud of you. If you guys see, 88% was the top scorer. I mean, for the last 3 to 4 batches, it had been all together reaching so many high scores of 80%, 79%, 78%. Can you imagine that 50% of the course who passed was above 78, which was a very huge score. So many students in 78, 79, 77, 80, and 88%. That was definitely the highest score ever for the written exam. Want you to get this reassurance that this is quite a doable one. And I want you guys to make it your strength, understanding that if they can do it, absolutely you can do it as well. All these give us strength. Many of them are Irish, many of them are practicing in Ireland. They have this necessity to complete this exam, but the overseas also did amazing. I mean, the way they have managed this, and now they are preparing for MRCPI OSCE February and May, and they were also starting like you. They also had lots of questions, queries to begin with. Would we be able to do that? Would we be able to manage that? All of them had same points in mind, same queries in mind, same anxious anxiety, and this will we be able to manage? How would be the study hours? What if we are not able to make it? And they all proved themselves to be the highest scorers, and this is what I expect from you guys as well, right? Keeping in mind that MRCPI written is online. Do you guys know the paper pattern? Do you guys know that MRCPI written is taking from home? Yes, all of you, Hania, Mahab, Usma, is that the info that you already know, or is it like I'm the first one telling you that you don't have to travel for MRCPI written exam? You know that. That's amazing. May I know the why you guys have planned MRCPI? Many of you give me a reason, ma'am, because MRCOG2 is quite difficult. So we thought that at least we do one of the international OBS and Gynae degree. Is that the reason, Tagreed? Leila, what makes you do, Omar, what makes you choose MRCPI? This is my first question. If our aims are higher and if our that inside drill is motivating, you guys would see every day that you will come back to studies and the guidelines very prompt because you have got a very strong motivation inside that I have to do it. Hannah Hassan says to get a certificate. That is, I think, 90% of the students they do for this reason. I do agree. Other than that, any other reason for anyone? Does anybody want to work in Ireland? Is it like that? Anybody wants to shift to Ireland? Yes? You want to have choose, okay, training in Ireland. All right, that's understandable. That's one of the pathway. Wa alaikum assalam, Shumaila Hamid. Thank you very much for joining in. To work in Ireland, Leila, that makes sense. Absolutely, it makes sense. So here I am to tell you that 2026 should be your completion of RCPI, and that's very much doable. When you clear MRCPI written in the March, God willing, with all this preparation, hands in hands being together, with my teaching techniques and with your study techniques, we are going to take May or November MRCPI OSCE, and you have all the potential to complete the MRCPI in one go, right? Keeping in view all this, which is the study pattern, before that some preparations have to be done, and you all have to be clear about why exactly RCPI is going to help you in terms of working in Ireland, of course, with the IMC registration, but it also gives you GMC registration, and that was not earlier when we were taking our exams, and that started up as a recognized qualification in General Medical Council in UK as well. So many of my students, many of the mentees, many of RFA alumni, they're working in United Kingdom because of MRCPI, right? And you can do that. In Gulf also, definitely yes, after the 3 years of experience post RCPI, you can have this specialization. You also can work in Ireland, you can work in UK. So it is a broad horizon, right? I won't say it is like MRCOG. MRCOG has got its own value, but definitely yes, MRCPI has got its own place that makes you recognized as an obstetrician and gynecologist. So that has its own value in all parts of the world. So the RCPI President Professor Mary Hogan said, and it's a significant development that widens the training and employment opportunities for doctors who have achieved our postgraduate qualification. And our college has always had strong links and excellent collaborative relationships with our colleagues in UK. This is further recognition of the high esteem that our membership exams are held in as a mark of attaining high quality medical training, Professor Hogan said. Therefore, doing MRCPI makes you have a better standing and improved standing both in Ireland, in UK, and of course in other parts of the world, especially the Gulf region. Where do you want to work or you want to choose as per your family circumstances, as per your family dynamics. All right. After you complete that, you have to go through OET and then you have to get the registration and the license, and you are all set to have the practice. So many CVs I get and so many students, they're settled in Ireland after doing the courses. So this is just the first step of ours. After completing that, then we can see the eligibility. I can guide you for certain areas where you have better opportunities, and alumni is always there to help you. You'll find RFA alumni everywhere to stand beside you and to support you to have navigating through certain tips and tricks to get better opportunities in life. Okay. Now, how is the exam pattern? What is the difficulty level? This is the first intro we are meeting, and I'm sure this question would be in all the students' mind, that how we are going to go ahead with, are they one exam, are there two exams, are there three exams? So there is a comparison. In MRCPI written, it is only one exam. Unlike MRCOG HANA, unlike European Board EPCOC, where there are two exams. HANA has a question, OET is needed for OSCE? No. For OSCE, the only requirement is that you have cleared the written exam. If you clear written exam, you can immediately take OSCE. My students who have passed in September 2025, many of them have taken OSCE with me in Ireland just now in November. So with a gap of 1 month, they're all set to clear, and I'm very hopeful for many of them who have done beautifully in their exam. So if you clear your written exam, you are eligible to take the OSCE and you can register for the OSCE exam. Clear? However, after clearing the OSCE exam and to have your registration with the licensing body, then yes, you have to do your occupational English test as well. Okay, so that is needed then when you need to have your registration with GMC or IMC. Am I clear, Hassan? Yes? Okay. So we were talking about the exam pattern, friends. The exam pattern is one exam, and the duration is 3 hours, right? One exam, and it's not at all exhaustive. Doing 100 single best answers is something which you guys would practice a lot in the study group. You've already started the books. When I will take the session after that, you'll find a change in your vision towards the guideline, and you will have only 100 single best answers with A, B, C, D, E. 5 options would be there, and you are going to select one correct option. The only trick which is in exam is that there might be more than one correct options. However, the practice which we are going to do is that we would have a single best answer selection. Did you guys get it? Right? It's not always that everything will be incorrect. There is a chance that you might get B also correct, C also correct, D also correct. But we have to select single best answer from there. Am I clear? Right? Now, exam format is very easy. We are going to practice from day one in a way that you do all the important questions. When you read a guideline, all the expected questions. I'll give you a glimpse today. I'm not going to teach you a complete sexual assault, but this is one Irish guideline where students are always scared of. But I'll tell you the glimpse that how I make the topic focused so that you understand that, okay, in this topic, what do I need to extract? What do I need to learn from this? What is the expected questions from there? How I need to solve those questions. There is no negative marking, so you need to solve all the 100 questions, please, making sure that you do not leave anything and it's sitting on your home in an application called Test Reach. You don't have to travel anywhere. In MRCOG, you have extended match questions as well, which are super difficult for the students. You have 2 papers in MRCOG, Gynae separate and obstetrics separate. You go to the Pearson Center and you take the exam. You've got lots of green top guidelines, nice and talks. However, in comparison in MRCPI, we have 100 single best answers in a single paper, and it's only one paper. You do that from your home, sitting in your home, in the comfort zone. Test Reach application, you need to log in, and it's an online on the screen, and 90% of the curriculum comes from the Irish guideline, and rest of it is associated with GTG, NICE, and talks as well. Is this part clear to you guys? Because if you know what the exam is all about, then only we can turn about and, be focused on what we have to work on. Thank you very much, Hannah, for your love. Am I clear? Am I clear, please? Did you guys understand what is the exam? How is the exam? What are the expectations from the exam? Yes? Is this clear that you don't have to travel for exam, please? You have to do 100 single best answers sitting at your home. Got it, everybody? Yes? Okay, great. Well done. Now, with this, you should know your eligibility as well. Remember that MRCP Hania is must, and we don't have any GYNAC MRCP I1. we only have in general medicine and pediatrics. RFA does coach for MRCPI Part 1 as well. Either you're taking in general medicine. Most of the students, they prefer taking general medicine who are not from gynec experience. But majority of you are taking MRCPI Part 2 written because you have an exemption for MRCPI Part 1, which is in general medicine. Like most of you have cleared MRCPI Part 1 and then you take your MRCPI Part 2 directly. Yeah. Or you've got the South African, New Zealand, Australia, Pakistan, specialization from Malaysia. If you have those for your own countries, you can skip. You can directly go to MRCPI Part 2 and you can have the exemption for the MRCPI Part 1 if you have these for your own country assessments. Am I clear? Right? However, you need to have a complete certificate of experience of 18 months of obstetrics and gynecology. Right? Absolutely, baby. You're going to get all this recording and it will be uploaded on your portal. Don't worry about that. Okay. And if any questions after listening to that, I'm happy to take that. Please get connected to me after listening to the session. And if anything is not clear, I will be explaining that to you further. Okay. So 18 months, you all should have a certificate, and I want to check those certificates now without any confusion, because when the application would open up, now we are taking this exam in the 5th of March, everyone. Love you more. Thank you so much. 5th of March is the exam for which we would be applying now, and a very important date which you have to mark in your calendars, and we are not going to let you forget because the study group would be reminding you again and again, is 3rd of December. 3rd of December is the opening date for the obstetrics and gynecology written exam. And I want you guys to make the preparation for that now. What is the preparation? Your experience certificate, your testimonial form, your pictures, all these things have to be ready. Later, once you clear, you can apply for the May 2026 OSCE or November 2026, as we started with an oath that we are going to complete this exam in 2026. God willing, 2026 should be completion of MRCPI for you guys. We are taking the first step for the March, and then May and November should be your clearing this exam for the MRCPI and get ready for the convocation. Yes? How many of you want to complete this in 2026 itself and not making it a delay? I'm sure. Thank you very much. Very well done. I want this enthusiasm. I want this help from you guys, that if I give my 100% in return, I get 200% from you guys, and you would see the change. Gradually after the sessions, students, they start feeling so confident. It's such a happy family environment in the study group. With hands in hands, they're working hard. And I love this togetherness with which you will make one aim and support each other to make it a success. Right? Okay. So experience has to be, Leila, 18 months minimum. You're going to have it. Make it ready for the 3rd of December, which is the opening date. And I want that we all just register, applications submit on 3rd of December without making a delay. Right? So only written is going to be applied on 3rd of December. OSCE, you can only apply when you get a passing result of written in front of you. All right. Usman, could I make it clear? Yes. So 3rd of December is opening date for March 2026 written exam. Clear? Now, all of you please write in the study group and tag the moderator to give you the testimonial form. And we're going to provide you with this testimonial form. I'm giving you 2, 3 days. You can get it signed by your any practitioners surrounding, any general practitioner, any specialist, anybody who's known to you, and please get it checked by me. Because last time there were so many rejections, unfortunately, of the applications, or they gave time further when the testimonial form was not correctly filled. This is the testimonial form by college. This is just to verify that yes, you exist and somebody knows you and somebody is actually giving a guarantee, who is a practicing person in any part of the world who knows you and basically verifies your identity and your work, right? Do not make mistakes. So many testimonial forms in my inbox, where the college puts an objection. You're going to take print out of that, right? And you're going to write the block letters name of the person who is signing it for you. It can be any doctor, any doctor. In address, please do write the hospital address and the registration number. If it's GMC registration, or if it's an IMC registration, or wherever it's Saudi Arab Board, whatever is the practicing number, the license number, that's going to be put here. Okay. And then the second person saying, please do not put it in joinings. It has to be block capital letters here, right? So if it is Dr. Alice, has to be like this. Okay, it has to be this way, writing down. You do not have to write it in joining. The college puts an objection and sends you back. Then you're going to write up for the person who is here. So the name of the candidate, for example, it's for Layla. So it's going to be Layla, second name, complete, that this is for this. And then this first person is going to sign here, referee 1 with the date. And then second person is referee 2, sign here and date. And then you scan this and keep it with you as a scanned copy. Am I clear? The first step is take a printout, take it to 2 referees. They write their names in the block letters. I always suggest writing email address as well. It's always better. My suggestion is write their block names, their hospital address, where they're working, and then their email address and their registration number, right? If you give this much of information, then it's a very solid testimonial form. Rejection or objection would be very, very less chances. Am I clear? Any questions from the testimonial form? Because when the closing date is there, then only college starts seeing, right? And the problem is that then if there is any objection, the college would say, okay, we are giving you 3 more days to please update it. So then definitely you are in anxiety and stress, okay? Those who are repeaters, when you're taking an exam again, when you open up the application and you open up your own application, the last documents which you uploaded are already there. So you just check them, scan them, that they're complete, and you just fill in the date and that's it. However, if they're missing in the folder, then the same documents you can upload again. I mean, I'm sure that you'll have it, the older documents which you uploaded for the last time. Got it, my dear? Yes? Okay, Usma says that I'm concerned about the experience certificate. Usma, can I know the query, please, so that I can help you? Anybody who has any query for the testimonial or for the experience certificate, please let me know. So before 3rd of December, in next 3 to 4 days, in this month of November, you have 15 days, but start getting it checked. I should be having your attested copy of the primary medical degree. Please make sure these things we have to prepare. Recent color passport style photo, pixels should be good. A copy of your Part 1 equivalent qualification like MRCPI Part 1 result, or whatever is your alternative as the permissibility to take MRCPI Part 2. Your testimonial form should be there with you, an experience certificate. Make it ready. These are the documents that should be ready. Maha says, when we do the testimonial form and we need to make an account in the website, thank you. Yes, you need to have the account on the website. Remember your password, remember your user's login, and testimonial form, you should do it in 2 to 3 days now. I mean, go to your hospital and anybody around can do that for you. Okay, the one who knows you, and you just need to put their data. Experience does not mention the specialty, just it has to mention Usma, Gynec, Obs and Gynae. It has to mention this word because the general experience is not accepted. It has to say the word doing the practice or working as an obs and gynae. Okay, you can send me, I can draft for you, I can tell you the words and then you can get it signed, my dear. I can help you with that, what are those things where they would be just having an objection. Okay, so Hannah, if you go back, guys, please see here. This was the 3rd of December. All of you, please pay attention. Opening on 3rd of December, closing on 14th of January. So what happens is that after 14th of January, the college will start opening the application. So in terms of verifying. So verification starts happening after 14th of January. That means that from 3rd of December till 14th of January, you guys have time. But I do not suggest going late. Why too? I mean, we should be ready and do that on 3rd of December, the first day itself. Do you guys get it? We have the full month of November to make things ready. Right? Okay. I mean, we send testimonial paper with date and booking. Now, the testimonial form, all of you please pay attention. You will take the printout. You will get it signed by 2 referees and then scan the testimonial form and please put it on your desktop, laptop. All these documents, we don't send by post, we don't send physical documents. They are all scanned documents and then you make one PDF and you put it on your desktop. The day the application's open, the scanned copies are on your laptop. You just copy, paste, and upload there. It's all online. Nothing, no physical copies being sent. Maha got it? Okay. So first you have to take a printout. Why? Because you have to get it signed and written, completed by the referees, right? But once it's completed, get it checked by me. And after that, scan it and scan and put it as a PDF on your desktop. Because when you click on the link on the opening of the applications, you just have to upload from there. Got it? Okay. There's no fixed format. Everybody has got different experience certificate, of course, the way the places where they're working, but there are certain lines that has to be there. It should be a gynec and obstetrics experience for 18 months mentioned at least. It can be more, of course, but at least this much should be. These 2 words should be there. Thank you, Maha, my dear. Did you get it, baby? Right? Okay, so this is the minimum thing that has to be there. Experience has to verify that it's gynec and obs, right? And second thing, it has to have minimum of the 18 months mentioning. Got it? Any questions regarding the document being ready? It's mandatory recent experience it is. So Layla, I always want you guys to show that you're current. If it's not, even then it's okay. But if you're current, do not use 4 or 5 years back. Do you get it? What I'm trying to say? I always want you to show that you are current. I mean, you are working. If it is the case. But if not, then it's okay. Anything which verifies that you have had 18 months, it's fine. Right? So many students, they write that this was the training time and then we are practicing as specialists, this, till this year, till date. So that does the job. But if you are taking a break, show what was the last time when you were working, that time you're going to take it for the experience certificate. Okay? It would get verified. Yeah. So I want that everything is attested, please. It should be attested by either the solicitor, it should be notary public, lawyer. Please have the attestation of every document just to avoid any sort of an inconvenience and delay in verification of your documents. Okay, every single document should be attested, including your primary medical degree. It should be a attested one. Okay. So after 2018 OSMA, if you do have an experience, it's better to put the recent one. If it's not there, then it's okay. Go ahead with whatever you have. So they will be accepting that. All right. All right, everyone. Any questions regarding the paper pattern? Any question regarding the documents making ready? Any question regarding the opening date, application? Any questions till now? I'm happy to answer. And I will be taking it further to tell you that why the preparation can be a little tricky in certain cases. Yes, anything which is not clear. Definitely in the study group, we'll keep on reminding you. And you have to give me all this preparation go ahead in time. So on 3rd of December, you all are ready. I have my private clinical experience, absolutely good. So many students, they own a hospital, and the HR of the hospital or the administration of the hospital gives them experience. That's absolutely valid, my dear. If you are working in your own setup, or if anything is there, that's absolutely okay. Does an Irish experience have to be attested? So, Rania, it depends upon from where it is. They say that attestation is always better that you do it. If it is by MRCPI or somebody which is in the setup, then generally it's easy for them to verify. Overseas, it's very difficult for them to verify, right? So they need attestations, right? However, you can tell me that which institute it is and where is it. I can just confirm that for you from lots of consultants there. Okay, got it? I can confirm from the college as well. Everybody clear? So if anything, any personal question is there, yeah, you're working as a private setup, or if you have any questions regarding verification of your documents, drop in a WhatsApp. All of you, please, you all have my WhatsApp, but the person who is still is not knowing, so please, this is the WhatsApp. You can drop in a message for your personal queries, that this is where I'm a little stuck up and I don't understand about my documentation. I will be guiding you as per your personal requirement. Especially for the overseas who are not working in Ireland. From my Irish students, they all know that this is a little straightforward in the country, but for you guys, I'm all here to guide you. Okay? Any other question? All right, great. Now coming to the point that why students they fail. When I'm saying it's only 100 single best answer, when I'm saying it's a doable exam, then what is the reason that students they still can't make it, or there is still some sort of a failure in this exam? Now, at the very outset, I would like to reassure that failures are very, very less in this exam. I won't say that it's nil, but comparatively as compared to other specialities and other obs and gynae degrees, it is less. But I see in those students who either have a mindset issue, who are passing through some exam stress in the end, not very focused in the type of the preparation, like, studying haphazard, and they're not understanding the exam strategy. This is the basic thing which I'm going to focus in first or two the initial sessions. The solution to that is that from today, you're giving a mindset, you're making a mindset that you all would be appearing in MRCPI Part 2 written in March. And from today, whatever would come our way, there will be ups and downs. There will be difficulties in the workplace. There will be ups and downs in the home chores. Household might get a little messy. Husband and wife, misunderstandings would happen. Children would be a little ignored, but we would stay focused. We would be ready to face all this, and in between, we would not lose hope of our preparation. Till the end, we will fight and make it very confident preparation plus very confident solving exam technique, right? Willpower is very important in these exams because we all have ups and downs, and there are good days and there are bad days. The days where we are like, well done, I'm doing great, and the days where we are full of tears as well. It's okay. This is how all they go through that. There are so many marriages going on, family functions going on, birthday parties going on, celebrations in the family going on. We need to be ready for the sacrifice. Without sacrifice, nothing would happen. So be ready to work hard and be ready to face difficulties. They would definitely come your way, but strongly, strongly have your willpower to cope up with that. A very focused study. Work, home, children, study is our life. Hana, this is our life. And you guys would see, once you will start understanding, you will start enjoying. Don't take it as a burden. Take it as a lifestyle. Like, with breakfast, I have to do this. With cooking, I have to listen to ma'am's session. When I have to solve the single best answer. In the first 15 days, I would like to organize you guys to make you like, to tell you that how you have to be in the next 4 months with me, and you would see the change. It's going to be an adaptation. We all would do it because this is how we have to make a balance between the lifestyle, the responsibilities, and of course, this is also what you're doing for your family, right? This is what you're doing for your betterment, right? So we need to just work hard, hands in hands for that with a focused study pattern. I'll just give you one example of a focus study just in the end because the topics are more I would be covering in detail in the premium sessions. But my way is that after the session, 80% of the data should be in your neurons. If not, then it's my failure. Everything has to be part of your memory, a very targeted approach, and the time management should be perfect. The It's absolutely okay, Shamila. It would happen. I'm telling you today, ups and downs would happen. Things would mess up. It's okay. We are ready for that. But we will fight back strongly. Yeah? So this is the whole curriculum in front of you guys. We've got RCPI specific Irish guideline. Absolutely not. I'm sure that I won't let you guys have Alzheimer's. Not at all, Maha. I can write it for you guys. In fact, you will be like as fresh memory as a childhood. You know, everything's gonna be in your brain, would drill in your brain all the points, and you would tell me in return that, okay, yes, this is the question coming up, and we are so confident in that. Yeah. RCPI specific Irish guidelines are the most important thing that you guys have to know, you guys have to remember. Moreover, you guys need to understand the content, right? This content which we are having is basically the major part that you should be knowing about and know the details of the RCPI very, very clearly. Irish guidelines are going to be the most important for your exam. The most important are going to be the Irish guidelines for your exam. And if you learn the Irish guidelines, you should be knowing about the every bit of the recommendations of the Irish guideline. Know that there will be some green top guidelines as well, specifically for those where the Irish guidelines cannot be done. And you should be knowing about that there will be nice guidelines. It has to be very clear that if something is not in the Irish guidelines, it is going to be the nice guidelines that you're going to cover with. All right, so if you have to make sure, that's the reason that I did the first part starting up with the Irish always. What is the reason for that? Reason for that is that the Irish guidelines make 80 to 90% of your curriculum, so I always start with them. In fact, when we do the sessions as well, I make sure that your Irish guidelines are on your tips. Not only today, when you appear in OSCE, 100 plus students are already there in the February OSCE batch. Whenever you're having the OSCE, you would always be 80% assessed from your Irish guidelines. Green top guidelines are also important, but second in priority. And this is the difference between MRCOG 2 and the Irish guideline in terms of the RCPI. Then we have NICE guidelines, Faculty of Sexual and Reproductive Health, which we have for the FSRH. Then we have the talk articles. You should be knowing about the details for this. And you be knowing about the talk articles are not all of them important. These are the topics that you're going to do, which would be told in the session, which would be in the daily schedule, and that will be enough. I mean, those talk articles which we mentioned, what you have to do from them, they will be enough. You don't need to worry about too much of a talk article. I don't want that you are so much into the entire curriculum that you forget the bases. I mean, the strength is the core curriculum. And then we have certain things for which we would be having superficial study. Now, my way is that I divide the curriculum always into best known. I mean, we can't leave that at all. Then we have those curriculum parts where the green top guidelines, where you should be knowing most of them. When it comes to NICE, FSRH, and talk articles, we can have a little superficial study. See, everything in the curriculum, OSMA, we can't make it 100%. It's humanly impossible. So the good student is who always divides and sets the curriculum into, for example, you should be knowing 100% of Irish guideline, right? You should be knowing 70% of green top guideline. 70% of when you pick up that nice guideline. FSRH, absolutely fine that you do 20%. Talk articles, 20%. Most of them, 50%, few of them. And when I start the session, I take my pen and I tell you that this is going to come. I'm not going to compromise with your memory from this part, but this part, take it easy. Don't spend too much time. So then you understand how to cope up with the whole scenarios in the curriculum. Do you guys get it? Right? This is how the preparation should be. This is how the smart students are. And this is how you make sections in your brain. All right, this cannot leave. This I can compromise a little. And this, it's okay. If at all this comes up in exam, I will be able to manage. Then you all would be aiming for more than 80%. My aim here is not to coach you guys to have only passing result. My aim is that you are to a point that when you appear, when you aim for your jobs, they know that, okay, your result was 80% and above. You see, RFA alumni, we had out of all the passing students, which were like 170, 35, 40 students, they were between 78 and 88%. So there were so many. On 80%, there were around 18 candidates. So you can imagine that how their status will be when they are applying, right? And when they are standing. So my aim is that it's not about that we should aim passing. You should aim such a higher score so that it adds on to your stature, it adds on to where you're going for an interview. So you stand out because of your result. And this is all possible. At the end of the day, guys, it's only 100 single best answers. 3 hours and 100 single best answers. With this preparation, you would see the change in your preparation. You would see the change in your approach as well. When we do the guidelines, we have to practice questions as well. Unfortunately, we don't have any RCPI special book by the college, but the MRCPI books like Andrew Sizer's, Amanda Jones, let me tell you guys, 50 questions from Amanda Jones, I can pick up and tell you guys that these are the recall questions, We've got Sir Janesh Gupta's book, we've got Mastering Sir Mustafa's book, we've got Succeeding as well. Sir Tahir Mahmood's wonderful book is there. Sir Kunja's wonderful book is there. We've got P. Sinha. All these books are in your channels. The only thing is that once you do the theory and then we can practice this. And RFA Tutor's own book of RCPI is there, which itself is sufficient to practice. And so many students, they say around 50-60% comes from there. All the live sessions in the course is going to be by me. Session recordings get uploaded after the live session is over, around 6 to 8 hours, and that stays with you till your exam date. You can listen to me as many times. All written summaries of Green Top Guideline, NICE guidelines, talk articles, Irish guidelines are there. And I have made separate folders of 2024, 2025 that you're going to do. Hannah, if you go to the daily discussion of books, we have made a schedule. All those books are important, which moderator is doing with you. You guys have the daily book discussion, right? All of you? Yeah? So those are important. We have made it in a way from important wise. I mean, the first, second, and third. So we are going from most important till the least important. Do you get it, Hannah? This is how the sequence has been made in terms of importance. Right? Okay. All the Faculty of Sexual and Reproductive Health summaries are there. So summaries are enough. Flashcards are there. It's enough. Summaries of Irish guideline are absolutely sufficient when it comes to bigger one, but you have to learn that, please. All right. Make sure that you do the Irish question pools. You do the question pools side by side. When I'll take the first session, you guys would be very, very clear regarding the applied clinical knowledge. And then you have the mock exams during the course. So you should be knowing that this part is done, I will take the mock exam. This part is done, I will take the mock exam. And that would create the difference in your applied clinical knowledge and in your approach towards the exam as well. All right. with all this motivation, with all this mindset change, I want very confident start. If anything's disturbing you, come to me directly. Message me directly that, ma'am, here I'm little shaky. 19th is the first session for the curriculum, gynecology. Then 26th, second, I've given you the whole detail. After that, we will do the exam questions together as well. All those who are asking for the link, who have joined from the open group, the subscription link of MRCPI March 2026 is there. For the newcomers, just for the group discount who are joining as a group, you can put in the coupon as well, MRCPI50, and that will give you 50% off as a group, and you all can join. Now, so many Sudanis again messaging Maha. I think 7 people messaged that they want to join that Sudanese group. I'm not very sure that you're aware about this, but I've told them, yes, I think Sahar messaged me. So all those who are coming as a group discount, just let me know, because then it is going to be a separate group and the access would be given after you have the collection of like, I think so far the Sudanese have messaged me, but whosoever wants, let me know so that you can be helped for that. Okay. I wanted to give one glimpse. Thank you very much, Hania, always there. I wanted to give you one glimpse. Now it's up to you guys. You want to learn the complete sexual assault, or I give you the glimpse that how I make things easier when it comes to the topic. Now, it is one of the most fearing guideline for the students. Always, they're so fearful for the sexual assault because in many parts of the world, they are not handling this type. They're not able to manage this, and they are not seeing such patients, right? Because of this, now they are a little concerned about how we are handling the questions. And unfortunately, the questions are coming from the sexual assault Irish guideline. Because it's more of the legal. Thank you very much, my dear. Always there for you guys. Because the sexual assault Irish guideline, that's a long one. I'm going to teach that to you guys. And every single aspect of 2023 guideline will be telling you about that, how the referral is done, how the forensic clinical examination is done, how the rape and the sexual assault in Ireland does that. The question comes from the start that the patient has had rape and sexual assault. So they ask you regarding they went directly to the accident and emergency, or they went to their GP, or they went to GERDA. So many of you, they don't even know what is GERDA. Anybody knows about this? Yeah? So in Ireland, GERDA, Shikana, these are what? These are the police officers, right? So you will see in the exam inform GERDA, and you will be like, oh my God, I mean, what is this? We don't know about this. So those type of questions, which are especially coming from the Irish guidelines where some Irish practices are there, then we are in a fix. And I will be concentrating in a way, will give you a short glimpse that either the sexual assault patient would go directly to the GERDA because assault has happened, or we'll go to GP or emergency department. And here we have to see the question very carefully. What are they asking for? What do they want from us? So what is the pathway which we have to follow? Remember that as per the Irish term, the GERDA is actually the guardians of peace, right? And these are Ireland's state police force responsible for maintaining the law and order, preventing and investigating crime, road safeties. You will see Garda cars and, national security. These are basically like in your part of the world, simple police network, right? Now, the possible scenarios, they come up in exam are generally coming directly to the GERDA. So you don't understand what's the difference in single best answer because you've not been into that scenario, right? So you have to understand that patient's wish counts. There is no obligation in Ireland, guys. Single best answers, you have to be so clear about the sexual assault. Patient wishes to seek advice from Garda? She can. Exactly, Hannah. Without making a formal complaint, without having a forensic clinical examination, she wants to seek advice from Garda only, and she doesn't want documentation. So the Garda is going to have arrangement of the counseling services, right? And the psychological support. Know about this, that there can be an informal discussion with Garda as well if the patient does not wish to document. Here, things are different in UK, in Ireland. Because when the students are taking MRCOG, a documentation has to be done, a detailed discussion has to be done. Here, it is going to be informing only if she wants to just seek advice without a formal complaint, then she has a right to do that. We cannot force any sexual assault patient to make a formal complaint if she doesn't wish to. Do you guys get it? It's a right. In that case, it would be informal discussion with them. And that's what's needed. We have the psychiatry support through the Garda. They take additional support, the psychological support, right? It is from the Royal College of the Psychiatry, where the psychological assessment and the support would be given. Now, this patient in exam has gone to Garda herself, right? And the other patient does not wish to go to Garda. It's all right. In exam, if you select, she comes with the sexual assault to emergency department. And the students who don't know, they would immediately select inform Garda. There would be one of the options saying inform Garda. They would go wrong. If she does not wish the Garda involvement, you proceed following informed consent with a physical or health examination at GP or at accident and emergency, wheresoever she goes. Right? And we tell her that if at any time you want to change your mind, you feel unsafe, you want an involvement of Garda, that would be option given to you. But if more time has passed, the forensic evidence may be lost because we have a time period to take the samples from the mouth, the different areas, urine, and we have samples for the anal, the rectum. There are time periods where we have to have the significant forensic samples. Do you guys get it? So the first concept which I have to make clear for you guys is that it is either involvement of the Garda or not involvement of the Garda. Patient has a right to do so. This affects the single best answer choice so much. So many times students, they just connect to the Garda because they feel, oh my God, it's a sexual assault and investigation has to be there. Did you guys get the point? In Ireland, as per Sexual Assault Irish Guideline 2023 till date, it is applicable. It is a patient's right to involve or not to involve Garda. 90% of the students don't know Garda, but now you guys are different and you understand that we are talking about the police involvement. Very well done, Hannah. And this is different to many of the European countries, please. Right? Okay. Now, 24/7, the psychological support is available, and the physical and psychological needs. If she goes to GP and emergency department, we have to make sure that we connect them to the role of the sexual assault treatment unit. That is SATU. SATU in Ireland is specifically that part which is like SARC in UK, Sexual Assault Referral Center. So we discussed with the patient that what is going to be SATU's role in that. And then so many questions, they come up in exam that the patient is coming up with GP and emergency department, what would be the next step? And then informing TUSLA, informing SATU. And students are like, ma'am, we didn't understand the question at all because they don't know the system. If she's coming at GP or emergency department, we tell her that we have sexual assault treatment unit which is a hospital-based services for people who have unfortunately experienced sexual assault. Now, can you force her to go to SATU? All of you, here comes the single best answer. The answer again is she has a right. You will give her the benefits that what is expectation in SATU, but she has a right to accept that and not to accept that. If you accept it, then the SATU is going to take the forensic clinical examiner, forensic clinical examination, all the details would be done there. If not, then if SATU is not involved, then you would examine the patient, document the findings, give the emergency contraception, chlamydia prophylaxis, hepatitis B prophylaxis, HIV prophylaxis, check for the safety issues. She is fine going back home. And then the single best answer says inform TUSLA. Do you guys know what is TUSLA? Thank you very much for asking. Why sexual assault questions are difficult? Because A option would say she has come in the emergency department, inform GARDA. And students are like, oh my God, GARDA, what is that? Inform SATU, inform TUSLA. And students are so confused. What is it? I mean, we've never read these terms. Remember, TUSLA is not an abbreviation. It's not a mnemonic. It's not something which we can expand. TUSLA is the name of Ireland's Child and Family Agency. It is responsible for child protection, welfare, foster care, and family support services. So, if a child undergoes a sexual assault, then TUSLA is there. If basically a child is a victim, then you have to consider TUSLA referral for safeguarding. Did you guys get it? These terms, you have to be very clear. First thing, police may be involved, may not be involved. SATU, we give her the option. She might accept, she might not accept. If you have done the history, you should know the checklist of the treatment. And if a child undergoes, yes, you have to consider referring to TUSLA because of the child protection. Are you guys getting the hang of it? These are the concepts which I have to build in knowing the understanding of the topic, which are different, which are systems that work in Ireland. So what is going to be SATU's response? If she agrees and she says, okay, please send me to the sexual assault treatment unit, this is one single best answer. So they say that she has been received in SATU. Therefore, it will be forensic clinical examination, her health check and care, collection and storage of forensic evidence without immediate reporting to GARDA. Got it? Right? So these are the 3 steps that would be taken in priority. Why? Because we have got a time frame where the forensic samples would do some sort of a betterment in terms of finding the results. Right? Now, if you have involved the child and adolescent forensic medical assessments, you should know that these child and adolescent services response would be urgent medical needs. If there are some bruises, some ailments, some trauma, TUSLA has to be informed if urgent safety concerns are there. And we have early evidence kit, clothing, nappies, bedding, if at all it's a child who has been through the sexual assault. These tables are very important. When I will solve the questions, I will tell you they will reach till one point and they will ask the next one from you guys. Now, forensic evidence is depending upon each situation. Like the medical stability is always a priority. For example, I give you a single best answer, everyone. Please pay attention. I give you a single best answer saying that the patient has come to accident and emergency and she is bleeding. Right? Scenario is 4 to 5 lines. A, inform GARDA. B, inform SATU. C, Take forensic samples urgent. D, stabilize the patient. And E might be history examination where you get confused. So remember, as per the guideline, the medical stability always is a priority. Very well done. I told you guys, Tawreed, you guys would be giving me the answer once I'll start teaching you. So you have a vision now. Informing GARDA is optional. SAT2, we consider informing. Take urgent forensic sample. Forensic samples are important, but stabilizing the patient is priority. History and examination would be after you stabilize the patient. Do you guys are getting the vision? How they give you a question, and the students who don't know, they miss out these questions, right? Now, for the patients who are having the rape and the sexual assault, the forensic sample idea should be very clear to you guys because they give you one single best answer, and students unfortunately find these questions difficult. See, if they give you two single best answers from this guideline and that affects you so much in terms of stress that you're not able to concentrate on the other questions. So basically, after the rape and the sexual assault, it should be a type of a seat where the plastic or leather should be there. It should not be quick bathing, shower, or douching. And the person should not consume food or drink, including alcohol, after the assault until the oral samples have been taken because it can affect our result, right? It can affect our result. Therefore, these come in the single best answer. They're easily understandable, but you should know that until and unless the forensic sample has been taken, right? If the vaginal penetration or the anal rape is there, then the person should not, if possible, hold the urine and they should not open their bowels to take the anal and the vaginal sample. Wipe the genital area should be avoided, and if possible, save any sanitary protection that was worn. For example, she was wearing some sanitary napkin or she was wearing some panty liner. If any condom was used, that should only be retained. These also, they come as single best answer. So you should have a very clear understanding for that. Now, if it's an oral rape scenario, in exam, if it's an oral rape scenario, we should tell them not to do the brushing of the teeth or the gargling or take some fluids of food and avoid smoking. Again, this comes as a single best answer. Are you guys getting that? I'm not sure you guys were ready to have the topic today or not, but I wanted to give a glimpse. Are you guys fresh? Or do you want me to cover in the sexual and health module during the live session? Or can I give you the idea? Yeah, can I take 30 minutes, or are you guys not fresh and you're not ready to have? Because my first role as a mentor is always that my mentees are ready to listen to and absorb. Yes, if yes, I will continue 30 minutes. I'm going to teach you this and then we are going to end up. This would give you an idea that how your preparation should be and how I would tell you that this information. Thank you very much, Hannah. So exactly, we have to take timed samples. Thank you very much, Shumaida. The clothing should also be saved and change out the clothing that's worn at the time of the rape as soon as possible. And then we have to put those clothing in a paper bag, not plastic. This is such a tiny point, but it is your recall question. How? They would say that save the clothing and put it in the plastic bags. And you're always making it, yes, ma'am, we have to save that because it has got some sort of an evidence. So it should be paper bags and not plastic, and immediately label, right? Similarly, some underwears worn after the incident should also be collected and placed in the separate paper bag. And do not handle the clothing. So if they're handled, then it has to be gloved hands because it's going to take your fingerprints and that won't be any more illegal importance for that. Okay. Now, generally, we don't want the clothing to be cut, especially from the damaged areas or breaks in the garment, because it might be a result of the assault and we are not sure that it's happened earlier or now, right? So we avoid that. Similarly, the blood, saliva, and semen stains, they are taken before cleansing, before the clothes cleansing, and the forensic swab should be taken from any wound area prior to wound cleansing. And for example, in emergency, you're doing a first aid and wound has got some sort of a fluid. So you can take the swab from the fluid and then you can do cleansing of the wound and do the treatment, right? Prior to wound cleansing, it's always suggested that you take the sample. Similarly, if anything like weapons or tape or bullets or paint, glass, soil, that is important. You don't cough or sneeze over the specimens. You don't handle the specimens. If the specimens must be handled, you actually do a gloved hand always, and always label them properly. All right. Now, as I mentioned, that you guys get confused with Garda. So you should be knowing when we are having Garda Shikana, you have to understand that in Garda Shikana, we have the concerns to prevent criminal offenses, informing them that the crime has happened and report further, right? Now, if she is not going to the Garda, we can't force. But if a formal complaint has been made to Garda Shishona, you have to fully investigate that complaint with Garda, right? So then the file is sent to DPP, who is DPP, Director of Public Prosecutions, and where directions are required to initiate the prosecution, right? So what is DPP role? That sufficient evidence to prosecute any suspects. The charges are there, right? And then the prosecutions of rape, they are heard in the Central Criminal Court before a judge and a jury, and then they make a decision that what final sentencing is given to the for the victim and by the assaulter. All right. These words should be known to you, not because that this will be asked as a question, because this would be mentioned. For example, they mentioned Garda in the question, you don't understand. They mentioned DPP in the question or the Central Criminal Court. You should know how the hierarchy works and what is the stepwise, because the questions, they make you confused. And to a point that November and May 2025 OSCE sexual assault came as a complete examiner discussion. So that means that college loves this topic. College is definitely going to assess you because they know this is something separate to what in different parts of the world is happening. They've got their own guidelines, right? After Garda, Hannah, after Garda, the Garda is going to report there. And then they're going to report to the criminal court. Do you get it, my love? Right? Very well done. Now, the single best answer comes from the early evidence kit. Early evidence kit, when you open, you've got instructions, disposable gloves, 5 swabs are there, small universal container, a large container, sterile water, and a tamper evident bag. You should know the contents of early evidence. This is not MRCPI written, but this is an OSCE exam question. So when I will be teaching you, I'll tell you that this part will be coming up in OSCE. So later, you can concentrate on that as well. So Garda, who is present for the collection of these samples, should have no prior contact with the suspect, right? And you have to always check the expiry date on the evidence kit. Always wearing gloves and make sure that the purpose of this early evidence kit to the complainant or the victim should be informed, right? Now, to enable that the forensic scientist is able to interpret the results, Garda should fill out the information from accompanying the early evidence kit so that the forensic scientist in the laboratory is going to get help from where the samples are taken, and it's perfectly labeled, right? Is it a urine sample? Is it an oral swab? So these all instructions, how Garda knows, they have the Garda portal where all instructions of use of early evidence kit is there, right? So early evidence kit, you should know the key points. The tables of this guideline are very, very important. how to use the swabs inside the mouth, from gums and teeth, from lips, and the forensic examiner should be able to do that. And if it's heavily blood stained, then the clothes are wet or heavily stained or wet blood is there, pack the items in separate paper bags. I repeat once again, plastic bags are not used, paper bags, and you submit to the Forensic Science Ireland immediately for drying and further evaluation for the laboratory testing as well. Okay, now anybody knows that what is KSATs? CASATS. For the safety, my dear, because the plastic that can intervene can affect, my dear, the storage, right? Okay. Now remember, the child and adolescent sexual assault is a separate treatment services, and we call them as CASATS, Child and Adolescent Sexual Assault Treatment Services. You should know that it is for under 14 years, and now if you get a 17 years, right, or 18 years, still they can accommodate adolescents as well. But purely they are for under 14 years. Do you guys get it? All of you? Now, what happens in exam? That if you don't know that they're dealing with which age group, and if you get a sexual assault of 22 years, and the option says that the refer to the services, the CASATS, Child and Adolescent Sexual Assault Treatment Services. So you get a wrong answer. So you should have this much understanding for that. Under 14 years are must referred. I repeat it once again. Less than 14 years are must referred. 14 to 18 years may be accommodated according to the situation. Clear, everyone? So know about KSATs there. What they do? Same thing, but here things are a little more sensitive. Why? Because children who have not reached the puberty will not have an internal examination. This is your single best answer. And in the end, when I'll make the flashcards for you, I will tell you that these points college always test you for. Blood test, urine samples, clothing, in addition to the forensic swabs that will be done. Intimate photographs may be taken by the forensic medical examiner. However, all these are separate to that of an adult because we need to be more sensitive and we need to be careful. Now, urgent medical care at times might be needed because the patient is always in a state of maybe trauma, physical trauma, right? KSAT TUSLA is a child protection. It's a safeguarding. For example, they have a threat. We have to safeguard. Why? How this happened? And here, this is for a forensic medical services. Here, they would take the samples. They would take investigations. TUSLA is a support system, Hania. KSATs is for the forensic medical kit, early evidence and all. Why forensic medical examination is separate? Because they are smaller, they are lesser in age. So there are certain rules. For example, we can't take the internal speculum here. So they are coached and they are trained to take the victims under 14 years. There are separate rules to take their samples. Got it? Right? So when the rape has happened, TUSLA is for their protection and safeguarding. It's a support system. This is a forensic medical services system where the investigations would be taken. Did you guys get it, please, everyone? Understood the difference between TUSLA? Yeah? Very well done. Now, the problem is that we have to take early evidence. Why? Because the presence of semen can be lost from mouth within 6 hours, from rectum within 24 hours, and from vagina within 48 hours. This is one of the very important single best answer, right? Similarly, the preventative treatment of STI should be commenced as soon as possible. Within 72 hours, the HIV prevention should be done. Emergency contraception should be administered as soon as possible within 5 days. You guys know about this. Otherwise, unexpected pregnancy can happen. Alcohol and other substances begin to reduce in the body within 24 to 48 hours. And according to the time period, according to the age. Please see here, Hana, Hania, everybody please see. They've written either refer to SATU or refer to KSATs, can provide advice and direction. Why? So here, SATU is going to be above 18. This would be must less than 14 or considered 14 to 18. Did you guys get it? Why? For forensic evidence. So basically, you're going to see the age in the exam single best answer. And then according to that, you're going to refer. I'm sending to SATU or I'm sending to CASATs. Got it, everybody? They are going to take the forensic evidence because we have only 6 hours for the semen loss from mouth, within 24 hours from rectum and 48 hours from vagina. So we have to make this time period into account so that we don't delay, because if we delay, then the sample would be lost and it won't be beneficial to take the forensic evidence. Am I making sense? Right? Are you guys understanding, everyone? This is how we have to make our RCPI easy, simpler. And this is, if I have to name one toughest topic, which I'm doing today, out of all the topics, this is the most difficult topic where students, they fail and they don't understand. Right? So if you understand today's topic, that means that rest of the MRCPI with me will be very, very easy for you guys. Right? There are different forms available at GARDA portal, guys, according to the age. The persons over age of 18, 14, under 14, and some protected persons with the guardians as well. Usma, we always ask the patient, does she have a right? In the beginning, I told that we give her the options of SATU, because if she doesn't want any evidence, we can't force. Usma, we can't force. It is by her consent only that she is ready to go for the investigation, right? Because she wants to know and investigate it further, right? When the child is 14 years of age and over, the consent of the child and the parent and the guardian is required. Please see here, Usma, consent is required. And when the complainant is a protected person or child under age of 14, then only parent. Do you guys understand? Who gives the consent? Remember, yesterday I got a message that, ma'am, I lost my exam last time. She was new to me. And she said that, ma'am, I was not understanding the ethics and the consent questions. So remember, consent, if she is 14 and above, it can be by herself or the parent or the guardian. But if she is less than 14, then it is parent only. Okay? Or guardian, whosoever, because it's a protected child. Exactly, yes. Well done. Above 14, it is permissible. Then it's very important that you know the transfer and storage of the kits as well. So we don't pack the medical form in within the samples. The forms are submitted separately, and samples must be packed and sealed in the temper evident bag that is inside the evidence kit. And GARDA keeps a record of the serial numbers, but don't make a delay for transportation as soon as possible, because this delay can also make us difficult for us for having the evaluation of the clinical significance of the semen, or for that matter, the results which we are getting. Okay. Now comes interviewing of the complainant. What did she do in terms of history? Either she is going to the GARDA, they will take a statement in writing, or there is ECI. If they use this word ECI, which is enhanced cognitive interview, they are generally from the adult complainants, right? And this interview should be conducted as soon as practically possible in a suitable location, balancing the need of investigation with the needs of the complainant, and make sure that she's comfortable in that, because then only we'll get all the information that what exactly has happened, right? If any physical injury is there, as I told you, that life-threatening conditions or bleeding are always priority. Please Do not select taking the forensic samples. I've seen students in the mock exam selecting the forensic samples immediately because they say, I ask them why. They say, ma'am, the time is very less. We will lose the forensic sample. I tell them, note on the cost of her health, right? So if any life-threatening thing which needs the aid, that has to be done first, and then it's going to be further, right? Now, other than SATU, can you guys tell me that do we have any way? Very well done, Hania. Now, at times, the comorbidities are there. Examination outside a dedicated SATU can also be done. So in that case, in each hospital, they have forensic clinical examination expert, right? That is a staff which is expert. If you can't reach to SATU, both the forensic clinical examiner and SATU support staff should attend such cases in that site where she cannot reach to SATU, right? They can give the medications, they can consider the potential sources of DNA contamination, and the patient is given a thorough details for that. Exactly, and they should have the early evidence kit available as well. Remember, whatever we are doing is absolutely by the consent of the patient. It has to be a valid consent. You have to document that consent, and remember that the patient may require additional support to make a decision, right? So they might give their consent verbally, but because it's a stressful time, the patient is also scared. So you need to give them all the support. The consent and the age considerations, I will teach you in the session of consent. There's a complete format of taking a consent, how we have to go ahead, what are those things. Moreover, every single injury or wound has to be documented. This is very, very important for OSCE. Examiner always asks you the site, the size, the shape, color, course, contents, borders, they all have to be mentioned. This table is typically important for the OSCE. Can we take photographs, yes or no? This is also one of the recall question option that take immediate photographic evidence. Can it be without consent? Can we take the photographs of the bruises? Or remember, you are allowed to take intimate photographs of the injuries, but always after consultation with the patient and GARDA and the patient's consent. A very important point for exam. Never without consent. We need consent. Otherwise, it is something where we are responsible for doing cross, against the law, right? Okay. Now, I expect you guys to do all the algorithms of the flow charts. Whatever I have explained is exactly in the algorithms in the sequence. When you will read the questions with me, you guys would understand that how it comes up. The psychological support has to be given, but you need to know that we have to do the medical aid as well. Gonorrhea, chlamydia, syphilis, hepatitis B, hepatitis C. All has to be tested and all has to be treated as well. And if she has symptoms of herpes, trichomonas vaginalis, or lymphogranuloma venereum, we need to have the treatment for that as well. We have very clear testing timelines at day 0, 2 to 4 weeks. And if the positive results for anything comes out as soon as possible, 3 months, 6 months, 8 months, we have to make sure that we do it. This is the outline which is given where we are concerned about the sites and the time limits. Therefore, we want to do it early. This is an important table for the single best answer, please. Vaginal, 7 days, rectum, 3 days, mouth, 1 to 2 days, skin, until washing, dead bodies, much longer period of time, dried seminal staining on clothing. Remember for exam. I will give you everything in your study group in my sessions. My sessions are absolutely sufficient, but this is not I end up the discussion. I have given you the detail of the guideline, an overview. This is just a challenging situation that I've picked up the most difficult guideline for the introduction. But the session will give you those points which you need to remember, because at the end of the day, we can't reconcile everything. We read it for once. The exam questions come as scenario-based questions. 25 years old, 48 hours. What is the management in the first 4 hours? You should know the immediate care, consent, referral, forensic exam, STI, pregnancy prophylaxis. 5 key important forensic clinical examination according to the Irish guideline. How does the management differ in under 14 after sexual assault? Because we don't refer to SATU. This is what they ask. What are the capacity and consent issues and legal obligations of delay reporting, right? Forensic sample timing. What are the time limits of collection? These are your recall questions. And if you leave the entire guideline, which I've given you an overview, and you just remember the sequence which I'm going to do with you guys, and if you just remember the consent which I am going to do with you guys, that will be sufficient for you in exam. In the end, I share certain flashcards, and those flashcards will be sufficient for you guys to learn and to comprehend, to do the entire thing very, very clearly. Do you guys get it, what I'm trying to say? For example, the first step is going to be that you read the guideline and you do the summary from the portal. The second thing which I want is that after reading the guideline, you guys learn the sequence and you do my flashcards. That would do the job. For example, you have done the sexual assault completely. And after doing the sexual assault, you guys are going to see that what exactly is the summary for this. After doing the summary, you guys would understand that I want to have the details of what questions are coming up, right? So only flashcards would be sufficient. If you see the exam points, that is regarding the first priority, all the exam questions are there. Consent and capacity, all exam questions are there. Referral pathway, all exam questions are there. Forensic relevant questions of exam, already there. Forensic examination step and the chain of evidence, all questions are there. Forensic sampling timelines, all questions are there. Infection pregnancy prophylaxis, all questions of exam are there. Mental health and psychological support, and in the end, safeguarding. All exam questions are in 3 slides with reference to what is going to be in the sexual assault. First, I will make bases for you guys. I would go to the detail of the topic, because we can't do the flashcards only if you don't understand and you don't have the hang of things. But in the end, when I give you solid points, this should be on your tip. So you understand that from the guideline, I am going to be assessed from here. Did you guys understand? This was just a tiny glimpse of your mentor to tell you that how I will be coming to your level. And let me tell you guys, 90% of the curriculum is very straightforward, easy to learn, which you are doing labor in your part of the world, VBAC in your part of the world, heavy menstrual bleeding in your part of the world. But these type of questions are difficult. That would make us go to 80 to 90% when we would be having skill in those topics which others won't know, and you guys would learn it. So if you remember the outline with me for the sexual assault, you would see stabilizing, consent, the referral, the focused history, forensic exam, forensic sampling, the management of the infection, psychological support, safeguarding, just life it's a child, documentation, chain of evidence, and follow-up. If you understand this scenario, none of the question won't be a difficulty, and it will be just like 2 questions which would make your score go up, because most of the students, they make these questions wrong. Am I clear? I could have very easily picked up diabetes, molar, and anything for a glimpse, but I wanted to tell you guys, if such a difficult topic can be easy for you guys, then the entire RCPI would be very, very easy for you in exam. Thank you very much. Any questions, anything which is not clear about the preparation, about the content, anything which you want to ask? This was just a glimpse what I'm going to do. And in this, Garda is police, TUSLA is social services for the protection. TUSLA can have few associations with Garda, but totally it's a social services that is separate. So there are two separate things. In simple words, you can replace the word Garda with police and you understand, right? For example, you're going through the road, you'll see, oh, Garda's car is there. So these are the police services, my dear. Got it, Hania? Thank you very much. Are you guys clear about how we are going to study? Are you guys clear about the next session which we are going to have, gynecology? How would you prepare? I will meet you after you prepare each topic for the live session. The recording would be uploaded and I want you guys to have a very thorough preparation before you meet me, because then we are going to make a very good memory together. Anything which is not clear regarding the documents to be ready, regarding the opening date, regarding the paper pattern, regarding the exam pattern technique, regarding the preparation. If anything is not clear, I'm here to help. Please let me know so that I can guide you guys and we will be meeting. Tagreed, thank you. Happy to join. Thank you very much, Usma. Thank you so much. Tagreed joined, I think, 2 days back. Yeah. All right. I'm so grateful, Usma. I would give my 100% to you guys. Would be super strict as a mentor, but you would see the change. I want you guys, again, my aim is not to make you pass this exam. My aim is that you reach to a point that if somebody looks at your CVs, looks at your attire, says that yes, we want you in our hospital, we want to keep you and make you an amazing specialist for the MRCPI. Thank you so much. Any question, please? Okay, what do you guys want for the live session schedule time? Are you guys happy with 5 a.m. GMT, or you guys want 1 or 2 p.m. GMT? Let's do poll in the group. I'm regarding SPA books, those shared in the Telegram group would be enough. Yes, Shamila, they're enough. Which are in the Telegram group, my love, they're enough. Okay, right? Okay, please confirm to me the live session timings. If you guys are happy with the mornings, I can do the mornings. But if you guys are happy for the 1 p.m. GMT, I can do that as well. Totally depends on you guys, whatever you guys are comfortable. I'm so grateful. Thank you so much. Thank you. Excited to be starting up this journey. I know many of you have been waiting, and I just want one strong faith and confidence that you all would not only be clearing this exam, passing this exam, but would be aiming for very, very high score. Sure, Shumaila, Humera, I can do that for you guys. Sure, no problem at all. Absolutely okay. All right, we'll decide the timings in the group and then we can do a poll, Vardha. That's okay. We can write both. Or what we can do is that if half of the people, they're comfortable in the morning, we can do Usma, we can do one morning, one evening, so that, alternate, so that all the students, they're happy. That's also one of the options. Is that okay? We can do one 5 a.m. and one 1 p.m. That's also one of the options. Yeah, so alternate, we can do that so that everybody is like comfortable in that. Yeah, I'll write in the group and we'll let you know, guys, whatever you guys are comfortable. Thank you very much, Maha. Thank you, Vadha. Thank you so much. I have very, very strong faith in the common prayers, please. Let's take 20 seconds of silence and let's have common prayers. Whatever faith in the world you all have, I need prayers for each one of us, that the step which we are taking today, that turns out and brings lots and lots of blessings. And may every day of this preparation takes you guys to the success. And whatever comes this way, may your focus stay there. May this bring lots of blessings to you and your family. And may March 2026 turn out to be the successful exam for you guys. And every step gives you confidence and brings peace and prosperity for you guys. 15 seconds of silence and then we'll call it a day. Ameen, Sumameen. Thank you so much, everyone. So I'm going to see you guys in the study group. All those who are asking for their friends, asking for their loved ones, and asking for their juniors and colleagues. The coupon is active. The group discount Maha, get connected to me, please, and make sure that they all join, because I don't want that the delay in the topics are there. Then definitely the anxiety and stress is more when the topics they pile up. And I'm sure that you all would do great. Help your friends, help them being together, hands in hands. Let's make it a success. Thank you very much. I love you guys. Take very good care of yourself. Best of luck from the entire team of RFA tutors. Wishing all the success in the world. Remember in prayers. See you guys with the gynecology with the next live session. Take very good care of yourself. Thank you. Bye bye. Love you guys more, Maha. Thank you so much. Take very good care, everyone. God bless you all. Thank you so much. Bye bye. Take care.